How do I get off GLP-1 medications safely without regaining the weight? This is the question I get asked every single week in my weight management clinic. In this video, I'll cover these topics, including a clear step-by-step GLP-1 medication exit strategy. You can see video timestamps in description to move to the section that interests you the most. And stay until the end because I'll tell you who should not come off these medications and what options exist instead. GLP-1 medications like Wegovy, Ozempic, Zepbound, and Mounjaro have completely changed weight management. But here's the truth most doctors do not prepare patients for, and what most patients eventually ask: do I have to take these medications forever? Hi, I'm Dr. Bazgha Khalid, and I am a board-certified internal medicine and obesity medicine specialist. And today I'll walk you through a realistic, evidence-based GLP-1 exit strategy, not hype, not fear, just science and common sense. What do GLP-1 GIP medications actually do? GLP-1 medications work by reducing appetite, slowing stomach emptying, improving insulin response, lowering cravings, increasing fullness. GLP-1 GIP medications like tirzepatide also improve insulin sensitivity further, act on fat tissue, and enhance metabolic efficiency. GLP-1 GIP medications don't burn fat magically. They change biology, so eating less feels possible. So who are GLP-1 GIP medications approved for? These medications are FDA approved for BMI of 30 or more, or BMI of 27 or more with a weight-related condition like diabetes, hypertension or high blood pressure, high cholesterol, or sleep apnea. Let's be clear, obesity is a chronic disease, not a willpower problem. So what does the science show? The clinical data regarding these medications is impressive but also honest. Clinical trial highlights for these medications show semaglutide, which is the active ingredient for Ozempic and Wegovy, with around 15% average weight loss, and tirzepatide, which is active ingredient for Zepbound and Mounjaro, with around 21 to 22.5% of average weight loss. These medications also improve blood sugar, blood pressure, cholesterol, inflammation, and cardiovascular risk. But when these medications are stopped abruptly, hunger hormones rebound, appetite returns, and weight regain is very common. This is biology, not failure. So can you get off GLP-1 medications? The answer is yes, some people can, but not everyone should. Let's talk about who may come off GLP-1 GIP medications successfully. Those who build strong habits, those with lower metabolic risk, those who stabilized weight for months, and those without advanced insulin resistance, and who should be cautious getting off GLP-1 GIP medications if you have long-standing obesity, type 2 diabetes, PCOS, strong genetic obesity, or multiple weight loss relapses. Remember, stopping GLP-1 medication is not a moral win, and staying on these medications is not a failure. It is all about what your health and metabolic needs are. Let's talk about the 5-step GLP-1 exit strategy. Step 1 is stabilize before you stop. Never stop while you're actively losing weight on these medications. Step 1 is all about stabilization on these medications first, and you should maintain stable weight for at least 3 to 6 months, have consistent eating patterns, hit protein targets, exercise regularly, and sleep adequately. Once you have mastered step 1, let's now move to step 2. Step 2 is build your biology support system. Before dose reduction, build these strong habits of protein intake of at least 30 to 35 grams per meal, fiber of 25 to 35 grams per day, resistance training 2 to 3 times a week, daily movement, and adequate hydration. Remember, if the medication leaves, the habits must stay. Once you have stabilized weight, build strong habits, let's now talk about step 3, which is the slow, strategic dose reduction. This is where most people struggle. Do's are taper medication dose slowly, extend dosing intervals with your physician's advice, reduce dose stepwise, and monitor hunger, weight, and cravings. Don'ts are don't stop abruptly, don't ignore early weight regain, and don't push through severe hunger. Once you have mastered step 3 of slow strategic dose reduction, then let's move to step 4. Step 4 is monitor and adjust. Early weight regain off medications is a signal, not a failure. When tapering or getting off medications, watch for hunger levels, portion creep, cravings, and weight trends. If needed, pause, taper, or return to a low maintenance dose. Now let's move to the final step, which is step 5. Have a plan B. Now, this is critical. If you start to regain weight soon after tapering or stopping GLP-1 medication, then options include low maintenance dose of GLP-1 medication, intermittent use of these medications, nutrition support, behavioral therapy, and other metabolic medications. There is no single finish line, only management. Now let's talk about some do's and don'ts. GLP-1 GIP medication do's are taper these medications slowly, prioritize protein, strength train, sleep, and track trends, not perfection. GLP-1 GIP medication don'ts are don't quit cold turkey, don't chase hunger, don't shame yourself, and don't compare to others. Let's debunk some myths. Myth is you're weak if you stay on GLP-1 medications. The fact is, obesity is a chronic disease and not a willpower problem. Another myth is everybody regains off medication. Fact is, regain depends on biology and strategy. Another myth is medications replace lifestyle. Fact is, medications support a good, healthy lifestyle. Let's talk about questions to ask your doctor. Am I metabolically ready for taper? Should I taper dose or frequency? What signs mean I should pause? What is my long-term plan? Is maintenance dosing appropriate? Comment below, are you thinking about stopping the GLP-1 medication, staying on it, or not sure yet? And if you're already tapering, what has been the hardest? GLP-1 medications are not a temporary fix. They are a medical tool along with healthy habits to support your metabolic health. Some people can come off these medications, some should stay on. Both are valid. Success is not stopping. Success is maintaining your health. If this video helped you understand GLP-1 exit strategy, then please like, subscribe, and share this with someone navigating GLP-1 medications. Stay happy, stay informed, and I'll see you in the next one. Bye for now.